So an important part of Reduce It that I haven't really expanded upon is the health economic analyses. I'm speaking with medical economics, so I've got to at least get the word economics in there a couple of times. And Dr. Bill Weintraub has presented these data as a late-breaking clinical trial at the American Heart Association last year. What that analysis that he led found was that icosapent ethyl, the drug studied in Reduce It, in the population we studied was highly cost effective. In cost effectiveness parlance, it was a dominant strategy in the majority of his simulations. Dominant meaning that it's not just cost effective, but it's actually cost saving at a healthcare systems level. Of course, at the individual patient level, that depends on a lot of things, what their copay is, et cetera, a little bit more complex. But from a healthcare systems perspective, a societal perspective, a highly cost-effective, as I said, actually, in many cases, dominant and cost-saving strategy. And that has to do with the fact that the drug had a large effect, not just in relative terms, but absolute terms on patients' ischemic events, influencing events significantly, including stroke, which has a lot of morbidity associated with it, heart attack, death from cardiovascular causes, but also endpoints such as hospitalization for unstable angina and revascularization procedures. So those sorts of events are important to patients and are legitimate to examine. This was a blinded trial with independent adjudication of endpoints, so those are really solid endpoints as well. But in the context of healthcare economics, especially in the US healthcare system, those are expensive events. If the patient's getting hospitalized for chest pain, if they're getting a revascularization procedure, whether it's stenting, especially CABG, lots of economic costs associated with that. But we reduced all those types of events significantly with icosapent ethyl versus placebo in the trial. And therefore, the drug emerged as being extremely cost effective. In Dr. Weintraub's assessment, really himself he's done a lot of cost effectiveness research, but hadn't come across anything really that was this cost effective, this dominant, other than things like generic statins or aspirin for secondary prevention. So that was really the league in which he put this, albeit branded prescription medication. So once more, I'm cognizant of the fact that on an individual patient level, a lot of things affect the cost to the patient, their prescription plan, what the coverage is, what the copay is. I'm really speaking at a healthcare systems level and really in terms of a policy level and implementation science, the value of icosapent ethyl, not just in improving patient lives, but potentially having favorable impacts on our societal health costs.
Great, that was fantastic. I think we covered all of the points that we need to on our end.
Yeah, to answer your last question, because I wanted to, it's medical economics, I had to speak about that topic a little bit. So just if you can rephrase or restate your last question, I'll actually answer that question now.
Yes, definitely. So we wanted to kind of just talk about some of the unmet needs in the evolving spectrum of cardiovascular risk management. And we want to kind of emphasize some research that's going on and talk about what's going on in the next several years. And if you want to highlight just some important developments and how you'd like to see the treatment paradigm shift.
I don't think there's ever been as exciting a time in cardiovascular prevention as right now, and perhaps the next decade or two. I spoke a bit in this segment about conventional cardiovascular risk factors, control of things like LDL cholesterol. I went into some detail on the more recent data about triglyceride-associated risk and the fact that we can target that risk with icosapent ethyl. I think there's a lot more we'll learn about that axis of risk reduction. Even though I was talking about triglycerides as a risk marker, it's not clear that the majority of mechanism of benefit from icosapent ethyl had anything to do with the triglyceride reduction. That probably had something to do with it, but really much of the benefit seemed to be from EPA or eicosapentaenoic acid and downstream effects that has, maybe things like affecting inflammatory mediators, and that could really be providing a bulk of the cardiovascular benefit more so than the triglyceride reduction per se. So I think in the next decade, we're going to learn a lot more about EPA or eicosapentaenoic acid and its roles in cardiovascular health and more broadly, perhaps in other areas of human health. There's a lot of interesting basic science going on right now. Dr. Preston Mason, a colleague here at the Brigham and Harvard, is doing a lot of work on cell membrane preparations and crystallography and how EPA and, for that matter, other omega-3 fatty acids interact with the cell membranes. in the cases of EPA in beneficial stabilizing ways. In the cases of some other omega-3 fatty acids, he's still trying to sort out what the effects might be, in some cases good, bad, neutral. So there's just going to be an explosion of science coming from a variety of basic science labs throughout the world on EPA and other omega-3 fatty acids. So I think it'll be an exciting field in general. So I'd say stay tuned for that. Beyond that, I think in the world of diabetes, we have seen an explosion of knowledge of drugs that not only reduce glucose safely, not only hopefully reduce microvascular type complications, but are now affecting macrovascular type complications and heart failure. A great underappreciation of how prevalent heart failure is, at least as frequent in terms of complications as MI. And now we have drugs to target that risk. So that's really exciting, both in a primary and secondary prevention diabetes setting. And I'm really referring to the SGLT2 inhibitors in terms of heart failure associated risk in diabetes, and the GLP-1 receptor agonists in terms of atherosclerosis related risks. And again, of course, right now, at least both in the US branded prescription medicines, some costs associated with that, but the clinical benefits of these drugs are really large. And I think if we can get these types of drugs on board early, we can potentially prevent a lot of the complications that occur from diabetes. So this, again, I would expect over time could have lots of cost-saving effects to the healthcare system, because diabetes and patients with diabetes and the complications of diabetes generate an enormous fraction of the healthcare costs in the US, also worldwide. But in particular, we're focusing here on US costs. In addition to excitement in that area, there's still other things going on in the lipid lowering space. There's some very potent agents being developed for triglyceride reduction that'll hopefully nail down whether triglyceride reduction per se reduces atherosclerotic risk. There are also studies going on of other ways of lowering LDL cholesterol, bempedoic acid, for example, a novel recently approved drug. Now there's a large outcome study going on with that particular compound. There are other novel PCSK9 inhibitors being evaluated, such as inclisiran, that could perhaps be given with a longer interval between dosing that might help with certain patients in long-term adherence. So there's still a lot of excitement going on just with plain old glucose and LDL and triglycerides. And then beyond that, a number of novel compounds that are being studied that specifically target inflammation as a driver of cardiovascular risk. So this is just a snapshot of some of the exciting things being studied in the world of cardiovascular prevention. So I think the first step and message would be implement what we've got right now in terms of aggressive lifestyle modification, and where appropriate, aggressive medical therapy, including polypharmacy, with the challenges that can pose in terms of patient adherence. But then beyond the implementation science of just using what we've got, lots of excitement in terms of things that are coming.